Hey guys, it's Dave. So you just got prescribed an antidepressant, or maybe you just haven't been feeling yourself for quite some time and you're looking at the possibility of getting an antidepressant prescribed to you. Literally, this video could take hours if I went through all the antidepressants, all the side effects, all the pluses, all the negatives of each one, and all the classes. So I'm just going to hit on a few highlights to get you started. First off, there are basically 6 different classes of antidepressants. There is the serotonin selective reuptake inhibitors, the serotonin norepinephrine reuptake inhibitors, the tricyclic antidepressants, the MAOI inhibitors, and then the atypical antidepressants. Now, each one of those classes have got different side effects, different positives, and different negatives for each one. So you have to look at that when you're considering starting an antidepressant or continuing on an antidepressant. But the one thing that they all have in common is, first off, they're going to take at least 6 to 8 weeks from when you start to actually see the good positive effects that you are looking for in that antidepressant, making you feel more like yourself, making you feel better, improving your mood. That's going to take up to 2 months to actually see. The side effects you may see in the first couple of days right away, and that's something you need to deal with and discuss with your pharmacist or provider. But the good things that you're looking for will take longer to occur. The second thing, with all of the antidepressants, I always recommend no alcohol the first month you're on it at least, if not longer. And the reason is alcohol is a natural depressant. So if you're depressed, you don't want to add a depressant to that regimen, along with the fact that alcohol does cause more side effects to occur and interactions to occur with antidepressants. So you've got to remember that, as well as other illicit drugs that are out there. The other thing that I want you to consider with that is, with all these different classes of drugs, they're working on 3 neurotransmitters. Serotonin, which helps your mood, helps elevate your mood, keep you in your normal self. Dopamine, which is used, the dopamine response is actually, it's decision making on how you think, impulsiveness, things like that. And then norepinephrine, which is your fight or flight complex. So that is what these different antidepressants work on. Each one works a little differently. Something else that I would like you to consider is genetic testing. They can do a test to see how your genes will actually respond to different antidepressants, and for that matter, antipsychotics, to see which one might be the best for you. That way, you're not waiting your 6 to 8 weeks because you tried Lexapro to find out, oh, it's not working, or it's got a ton of side effects for me, so now we're going to try Prozac, and it's going to take 6 to 8 weeks to find out if it works. And then at that point, if that doesn't work, we might have to try Trintellix to see if that one works, and that takes another 6 to 8 weeks. I know a lot of insurances do not cover it. I also know they're not available everywhere. You'd have to check around your area, but certain mental health centers do have it, certain pharmacies, and certain doctors do make them available. They're not always going to work, but it may narrow the time and the frustration of going through several different drugs to find the right one. I have had a patient that we still had to have about 3 or 4 different trials before we actually found the one that did work, but it is a good option out there for you. Now, to give you a little highlights from each of the different classes, the SSRIs, or the selective serotonin reuptake inhibitors, a couple of examples are citalopram, which is Celexa, and escitalopram, which is Lexapro. In that class, for some people, they can cause you to be drowsy. So I always tell my patients to start out taking in the evening in case it knocks them out. But for others, it can do absolutely the opposite and keep you wide awake. So you may want to start those, if it does make you wide awake in the evening, move it up a little bit each day. So you take it in the morning, therefore it'll keep you awake during the day as well and not keep you awake at night. With those as well, some people, it can cause weight gain. But in others, it can cause you to lose weight, and not in a good way. So you want to monitor your weight, see how that goes. If you're not having any issues, great. But if you're gaining a lot or losing weight that you do not want to lose or need to lose, talk to your provider about making a switch, not only maybe in that class, but maybe to a different class. Then you have the selective serotonin and norepinephrine reuptake inhibitors. And in that, you're getting a combination effect. With those, you're looking at drugs like Cymbalta or duloxetine, Effexor or venlafaxine, Sabella is another one. Those are just some examples. With those, you really want to monitor how you taper on them. And if you ever need to taper off of them, because they can be a real booger as far as knocking you out and as far as withdrawal symptoms when you come off of them. With all antidepressants, you should really taper on and taper off. But with this one, especially in this class, you really want to make sure you're going slow, going up to the effective dose, and when you come off, you go slow to come off because of those side effects. So really monitor that when you're doing either one. A third class of drug is the tricyclic antidepressants. This is an older class. They're basically all generics now, which that's good because they're cheap. And you see them used for more than just depression. You've seen them also used for sleep. I don't agree with it, but you can see it for that. You can see sometimes they use it for trigeminal neuralgia or nerve pain. Some examples in this class would be doxepin, amitriptyline, which is a generic Elavil, nortriptyline, which is Pamelor, and imipramine, which that one is also, I've seen that used for a lot of times in bedwetting situations. With these, you have a long list of side effects, but the main ones are, of course, drowsiness, dizziness, but they can cause you to have dry mouth, dry nose, dry eyes. So something like lemon drops or Jolly Ranchers are a good idea. Artificial tears are a must, especially if you wear contacts. And like a saline nasal spray or even a little bit of air gel in the nose can help out with a dry nose. Be careful driving with this class, especially because of the dizziness, drowsiness effect. If you're having issues, make sure you talk to your pharmacist or provider about that and what you can do to help combat those issues. Monoamine oxidase inhibitors, MAOI inhibitors. Again, an old class of drug. There's not very many of them out there, but you do want to be paying attention if you're put on this medication, because there are a lot of drug interactions between prescription drugs and over-the-counter drugs. And you do have to watch out, because if you've taken those drugs in the last 10 to 14 days, the over-the-counter drugs or prescription drugs that the MAOI inhibitor interacts with, you still can have issues. So you want to make sure you talk to your provider about things that you've taken in the previous 2 weeks prior to starting that drug, as well as if you stop that antidepressant class, for the next 2 weeks after, you also want to watch out for that. There are several supplements and several cold medications that interact with these drugs. One of the examples of an MAOI inhibitor is phenelzine. And that I have had a patient with that drug that took an over-the-counter cold medication and had a very severe interaction that ended up putting her in the ER. So really watch out. Talk to your pharmacist if you're on that class of drugs before you take anything over-the-counter or prescription-wise, so they can monitor for drug interactions. Then the last class that really is out there, and like I said, there are natural ones as well, but the last main class you're looking at is called the atypicals. And some examples of atypicals are trazodone, which is also used for sleep as well, Trintellix, which is a newer one, quite expensive, And another example would be Wellbutrin or bupropion, which is also used to help smoking or stop smoking. One of the advantages to like Wellbutrin is if you're having trouble with one of the other classes in gaining weight or losing too much weight, Wellbutrin seems to be pretty stable as far as you can be on that one and not gain a lot of weight. There are always exceptions. I've had patients that have come to me and said, you know, I know this was supposed to work and not cause me to gain weight, but guess what? I've gained 25 pounds. But for the most part, that's one that you can be on and not have as much weight gain issues. However, it's also one that if you've ever had seizures or if you're an epileptic patient, you do not want to be on Wellbutrin or bupropion because it does lower the seizure threshold. So be very aware of that, as well as with the trazodone, it's used for depression, but it can make you tired. So when you take that, you want to take that one at night. Mirtazapine or Remeron is another one in that class that also can make you tired. So if you take it, you want to take that one at night instead of in the morning. I hope this has answered some of your questions. Check out our TikTok. We always have TikTok videos on individual drugs for med tips that we may be able to answer some of your questions on there as well.